preparedness for low and middle income countries. So we fall in low and middle income countries. So the preparedness of India for pandemics and emergency response is what I'll present. And another term has come, One Health approach. So probably now people are well aware of One Health and One Health approach. So I don't need to explain that, but then it's collaborative. Whatever we do now is all collaborative. Intersectoral. So many sectors are involved and multidisciplinary. Different disciplines with only one goal, to bring optimum health for humans, with the consideration that everything is interlinked, human, animal, plant, and their shared environment is interlinked. So we are working with every partner, every collaborator on this One Health. And let's see what India is doing. February 29th, 2024, Prime Minister laid foundation stone of National Institute of One Health in Nagpur. And for One Health, there are 3 ministries that are involved: Ministry of Health, Ayush, as well as Environment, Forest, and Climate Change. Different councils, medical research, agricultural research, DST, DBT, different departments. And then there is an Apex Steering Committee that is led by a Principal Scientific Advisor, and I happen to be one expert of that committee. Then we have One Health Action Group at national level, and then we have various teams working at the state level. Different NGOs, government agencies, private partners, everybody is part of this. And in August 2024, we had Pandemic Preparedness and Emergency Response Framework for Action. And 4, I think it's not very clear, but then there are 4 components of this. One is pertaining to governance and management. Second is regarding surveillance, and to look for different, like preparedness for pandemics as well as surveillance. Third one is to work with different agencies for newer diagnostics, therapeutics, and vaccines. The fourth one is advocacy and communication with different partners, like I said before, private or NGOs, even the general public. So this is what National Institute of One Health will look like in Nagpur. I was fortunate to work with people in Nagpur while we started working in 2011, when Dr. Kotoch asked us to start a joint project of ICMR and ICAR on zoonosis. And all those efforts have culminated after 10 years into setting up of this institute. Like I said before, there are multiple sectors, there are multiple stakeholders. We are talking about livestock health, we are talking about human health, as well as environmental health. We are working on capacity building, so that is one component. I'll talk about that later. National network of BSL-3-4 labs. Hyderabad is fortunate enough to have multiple BSL-3 laboratories in the university. CCMB, CDFT, AIIMS will also have one such lab. Developing tools for surveillance. Integrated surveillance at the interface of humans and animals as well as environment. We have been working with IDSP, but then we have been working in silos. Now there has to be an interface, and all that data has to be integrated to look for different outbreaks, different epidemics, and future pandemics if there will be any. So like I said before, there are different agencies that are working in tandem, and we are working in different labs that have been set up by ICMR. ICMR is setting up more laboratories, both BSL-3, BSL-2, as well as BSL-4, and the money is coming from PM-ABHIM. PM-ABHIM is Pradhan Mantri Ayushman Bharat Health Infrastructure Development Mission, and different other laboratories are also participating in this. So that is at the national level. Now coming to regional level, so there are regional coordinators that have been established by National Centers for Disease Control, and AIIMS Bibinagar is one regional coordinator for Telangana. There are sentinel surveillance sites, 3 in Telangana, 1 in Osmania, Kakatia, as well as in Adilabad. For us, another one is in Bangalore Medical College. So we are working with the partners and collaborators, like I mentioned before, for priority diseases, but then you never know what disease will come up. And this is how, like I said, Institute of National Importance. So AIIMS has been designated as Institute of National Importance. We started our department in December 2020, and we were fortunate enough to have VRDL and regional coordinator for One Health, and then BSL-3 lab. Now we have signed the MOU also for setting up of this laboratory. Now, when we talk about One Health, and then we talk about like different aspects, human, animal, environment, there is a lot of overlapping. Now, like I said before, people are working in silos. How to bring everybody on board working for the same goal for optimum human health? So we developed this model which we call as a constellation model. We have copyright for this model. So this model can work for zoonotic diseases, AMR, anything you can fit into this model. So in the center, where we have written One Health, I'm talking about zoonotic diseases, but then we can also talk about vector-borne diseases, AMR, diseases related to climate change, biodiversity loss, contamination, pollution, anything. Then in green, we have what we can do. So like I told before, integrated surveillance systems that government is developing, educational campaigns. So we are also working on developing curriculum for One Health, community engagement, policy development and advocacy, interdisciplinary research and collaborations, enhancing veterinary public health, and environmental conservation and management. So these are the green points which are to be worked upon together with one another. Then we have different departments that will work. So like public health department, microbiology, epidemiology, environmental health, ecology, wildlife, veterinary medicine, anthropologist, agriculture, geologist, hydrologist, climate change. Everyone is partner to this. And then we have priority zoonotic diseases which have been set up by NCDC, but then like I said before, anything can come up. And then we have human health system and policy and veterinary health system and policy given as pink outside, and different organizations. Under One Health Mission, we have ICMR, NCDC, which are main agencies working for health in humans. And then FSSAI, we have Wildlife Institute of India, Ministry of Environment, Forest and Climate Change, Indian Council of Agricultural Research, Department of Animal Husbandry and Dairying. We have VRDLs, Regional Coordinator One Health, then State Sentinel Sites, then State Level Zoonotic Committee and District Level Zoonotic Committee. At international level, we have WHO, we have FAO, we have the World Organization for Animal Health, and we have UNEP, that is Environment Program. So this is the total framework, starting from the local level to regional level to national level to international level in one picture. So while we started our institute, we had to have some vision. Like I told last time, Dr. Lakshmi, that Hyderabad had microbiology, Hyderabad had health, Hyderabad had corporate hospital, everything. Means if we had to do, either we had to follow what the others were doing or we had to do something unique. And we chose the second path. So we started our vision for One Health at AIIMS Bibinagar with a goal to assist the country's efforts in implementation of One Health paradigm through transdisciplinary, multisectoral and collaborative approach. So this we wrote in December 2020 when all of us, 6 of us to be precise, sat together to start the department. And then, like I said before, we became VRDL, we got BSL-3, and then ABSL-3. Dr. Vinay was kind enough to give us like a free support to perform different experiments. The deliverables that we kept was modeling, prediction, prevention, and control, evolutionary aspect of different organisms, newer diagnostics, drugs and vaccines, and anthropological aspects. And let's see how we fared. And we wanted from the susceptibility of human beings to the resilience. But then we wanted to see whether the system that we developed was sustainable, and number 2, what are the economics involved with that. So with that vision, we prepared a vision document with NCDC. We were new, we didn't have a laboratory, we had only one microscope borrowed from Department of Physiology. So we needed partners. And we went across to every organization for partnership. Indian Council of Agricultural Research had an institute called National Meat Research Institute. They were kind enough to help us. CDFD, CCMB. Then we went to different states also and different hospitals in Telangana. And then we had to work with partners, so we started having these workshops and programs on One Health. So this is with NIAB. They were kind enough to help us. Dr. Majumdar was very kind, in fact. Then we got involved with the government sector also, and on veterinary side, animal husbandry side. And then we started observing One Health Day and started inviting people from outside. And then we went to the community. So this meeting was conducted in Bhongir with the different partners. So since we had to start from the local level, the first and foremost thing required was mapping of different health sites in the district. So we went to every PHC, CSC, subcenter, and now we have contact everywhere. And then we had to work with the community. Now community needs constant engagement. We need to talk to people almost every other day. So what we decided that we will develop, we do have health and demographic surveillance systems across India. Pune has very nice one. Bangladesh has also very nice one. So we developed a new one called One Health Demographics Health and Surveillance System. And these are our activities. So we not only worked with human health, we also worked with animal health as well as environmental health. And to start with, we started with like 8 high animal density villages. We have only reached up to 4, but we intend to move further. And these are the 8 villages. So the villages are also located strategically. 4 of them, they are on River Musi. So River Musi flows through Hyderabad, but then it comes to Yadadri, Bhuvangiri, so that we selected villages over there. And then 2 villages on the tributary to River Musi and 2 more villages which had lakes there. And these villages were high animal density villages. And this is how the village, one village is using Musi River water for growing rice and then sending it back to the river. If you go to that village, 50% of those people will have fungal infections. This is second village where a new dam has come up. Newer infections are coming up there. We are not talking about it now, but then we also included that village. And then we started collecting samples, we're talking to people, collecting data. And low-hanging fruit was diarrhea, and diarrhea in children. So we had this hypothesis, like COVID was there, so the children did not come out of the houses, but deworming was continued. So ANMs were working during that period. Mission Bhagiratha was functional, Swachh Bharat mission was ongoing, and open defecation free status was there. So our hypothesis was, if this is happening, then ideally speaking, the human pathogens should go down. And if human pathogens are going down, then something has to replace them. So then it has to be animal pathogens. So we started with this hypothesis. The first study that we undertook as a STS project in Anganwadi was to look for soil-transmitted helminths in children. Second study was to look for diarrheal agents in under 5 children. One study looked for viruses. Same same samples we looked for bacteria also. All these 3 studies are completed. Fourth study was, if this is happening, so after these children they recover, whether these agents are still existing, animal agents are still existing in their intestine. And the last study is what is happening to the larger community. So let's see. These are the results. What we found, that the animal agent EAEC has actually replaced enteropathogenic E. coli in the community. Now you may still find children with EPEC in the hospital, because all those who will be sick and parents will perceive them to be sick, they will bring them to the hospital. So the larger population will be EPEC, but in the community EAEC has replaced EPEC. Rotavirus has gone down, norovirus is coming up. And so, and Campylobacter is also contributing to diarrhea. And see, asymptomatic carriage also EAEC is there, ETEC is less, Campylobacter is almost 10%, Salmonella is also there. And then we tested animals as well. So in animals also we have EAEC, no ETEC, no EHEC, like as expected. And Campylobacter, of course, we did not find Salmonella. And then we also found these rota and adenoviruses. Since adenovirus outbreak was going on, so the more percentage was observed, but then we don't pay much attention to that because that could be just a chance finding. We also conducted with the CCMB under Rockefeller Foundation project, surveillance for the environment. So surveillance is already ongoing in Hyderabad, Delhi, Pune. So we were partnered to that for the Hyderabad cluster. So with the Shillong and CCMB, we are working for this Hyderabad cluster. The main aim was to look for different agents in the urban area, but since we had this OHDSS, so we wanted to work in that area, and same village is the 4th that we selected. So we took samples, sewage samples from starting of the sewage line to the end of the sewage line. Telangana is highly evolved state. All the sewage lines in the villages also are closed, except for that one village which had new reservoir that has come up and lines are open, but rest it's all closed. So this is how they are closed, and then we collected such samples, the sewage samples, and this is what we found. Different agents, different bacteria, they are there in the sewage. And it's like the first graph, if you see on different dates, so the first one is like start of the sewage line and end of the sewage line, and Pseudomonas eventually replaces everything towards the end. And this is what we found. So ARGs were there in the environment, in the villages where you don't expect antibiotics to be there in the sewage. So ARGs were there, but then they are there, yes. But then whether expressed or not, it's difficult to say because we are still testing and we will come up with the results. But then see Oxa, New Delhi, metallobeta-lactamase, all these ARGs are there. So that is at the local level. So we created OHDSS, started working with Yadadri Bhuvangiri, but we wanted to go step further. And climate change, Telangana, we have at least 5 districts that have been climatically vulnerable districts, ASIF 5, yeah. So DST had this report, so we wanted to work with those districts. We started with Asifabad district, that is most vulnerable to climate change, and that is the agency district, least developed district, second least developed districts in India. Second one, we took Yadadri Bhuvangiri, that is moderately vulnerable. We have near to Warangal rural that is vulnerable. And third one is Nizamabad, which is right now not vulnerable. So what we wanted, like I told you, we started in 2020 December. So we just had a temporary center there where we are still functioning. We wanted to go for NABL. Yesterday we had this assessment and found that we don't have a lab, proper lab. We are just working in a makeshift arrangement. So still working there, but then we have created OHDSS with 20,000 population, which will increase to 150,000 population, because now we have to know how the outbreaks are taking place. We have to train people for such outbreaks, and we have to test neurodiagnostics, vaccine and therapeutics. So we need mapped population. Then we will have a permanent center. Now the new building is coming up and our BSL-3 lab will also come up. And then we also want to have a center in Asifabad. So this is how our plan is. So after 6 years and beyond, we should have BSL-3 lab and a center in the Asifabad. And this is how we wish to engage and assist the state of Telangana as One Health initiative, public health initiatives, digital health initiatives. Through eSanjeevani, we are already reaching to 760 sites across Telangana, and holistic health initiatives. So I told you about Indian Council of Agricultural Research, National Meat Research Institute. So we are working with them. And the first study, those studies, collaborative studies were there in the Yadadri, but now we have started one study funded by ICMR that is on slaughterhouse workers. Nobody goes to, when we went to IEC, they said don't go to slaughterhouse because they are not safe, you will be killed. Now, whole of the microbiology department is in slaughterhouses, and this is what we do. So we have also created a health and demographic surveillance system for slaughterhouse workers, their families, and everybody. So trust. So they are now not our patient, but our friends, and we are working with them for their samples as well as animal samples. So, and then we had to go to Asifabad. So where to start? So here Yadadri, low-hanging fruit was diarrhea. There already Osmania has a regional center for STI-RTI. We did not have any chance. So we are going to Asifabad and trying to look for health-seeking behavior for STI-RTI in the tribal population. So it's a multicentric study, task force study across South India, one site in Himachal Pradesh also. So we are also part of that. And then second thing, which was near to, since it is near to Gadchiroli and a lot of malaria, so we are working on Vivax malaria and how primaquine is being taken and monitoring of that primaquine taking for 15 days through mobile application. That is what we are doing. And since we have to train health force for One Health, so we are working with NCDC to have a Sector Connect One Health Fellowship. So that is what we will start in AIIMS Bibinagar, and AIIMS Bibinagar is the only site from medical side to work for this fellowship. And since we are a degree awarding institute, we will also award that degree. So along with NCDC, ICMR, and different agencies. So we participated in SAPRE, that is State Action Plan, and I'm very happy that now Telangana also has State Action Plan for AMR, and we also keep on preparing documents and submitting to NCDC and ICMR, and since this is on AMR, so we have this project which we tend to implement again in Yadadri, Bhuvangiri for the PHCs and CHCs and for antimicrobial stewardship. So we call it as a Samrat, we like a name. And then we also have this another one for our hospital, we call it Praman. So basically we want to get engaged to antimicrobial resistance and its prevention. You know, means I personally feel it's very easy to sit in this kind of environment, and so we are, yeah, I'll finish. 2 minutes, sir? Yeah. So, then we are also working on institutional integrated antimicrobial stewardship, but then I personally feel that everything has to be implied. Once we make anything explicit, no, people will talk about it and then forget about it. If it is implied and ingrained in the system, then only it will be sustainable. So sustainability of One Health, including AMR, is important. So we have different responses. And then this third model for the community, so we call it as crab at hip. So this is what we are doing in the community with CCMB and with ICAR. And this is how our lab will come up. And so this last slide, sir, future implementation strategy. We want to work in the climatically vulnerable districts of Telangana. We want to work with particularly vulnerable tribal groups and other tribal groups and high animal density villages. We want to, we are working with this Pondicherry ICRC, VCRC, Vector Research Institute, so with rodents and other animals as well as vectors. And what we want to have, end goal is predicting and preventing outbreaks. Cost-effective diagnostics, development of newer vaccine therapeutics and diagnostics, and control of vectors. So that is our end goal. Thank you so much.